there.
Hello.
My name is Rylie. I'll be your student nurse today.
Nice to meet you.
Before we get started, can you just verify your name and your date of birth for me?
Andrew Butson, 10-3-95.
Perfect. And do you prefer to be called Andrew or Mr. Butson?
Andrew, please.
And what brings you in today?
Just annual checkup.
Okay, yep, that's what we've got you here for. It looks like they got all of your vital signs, your weight, height, and BMI out front before you came back here, and that's all been put in the chart. Before we get started, I'm just going to apply some hand sanitizer.
Okay.
So today, what we're going to be doing, where it's your annual exam, we'll be doing a head-to-toe assessment. It's just like what it says, head to toe, so I'll just start at the top and work my way down.
Perfect.
Before we start on that, I just have a few questions to ask you.
Okay.
Did you drive here today?
I did.
Okay, and do you live here in Twin Falls?
I do.
Okay. Can you tell me what the month and the year is?
February 2024.
And who is our current president?
Joe Biden.
Perfect. All right. Do you have any allergies to any medications?
Amoxicillin.
And what kind of reaction does that cause?
Just rash.
Okay. And are you experiencing any general pain today?
No pain?
No pain. Okay. All right. Well, then we'll just go ahead and get started, okay? All right. I'm just going to put on some gloves because I'm going to be feeling through your hair and stuff.
Okay.
Have you experienced any pain or tenderness on your head recently? We'll just be feeling around.
Okay.
For any lumps, bumps, lesions, moles, things like that. Any infestations. All that good stuff.
Fun stuff. Sounds good.
Maybe if I can get this darn glove on. There we go. All right, let's take a look here. Any pain or tenderness there?
No.
Okay, head symmetrical. Do you have any bumps? I don't see any lesions, moles, no infestations. Okay. Next, I'm just going to feel around on your face.
Okay.
I know it's kind of invasive.
No, that's fine.
I'm just checking your sinuses for any pain or tenderness.
Okay.
Do you have any history of any sinus issues?
No.
Okay. All right. Just going to gently kind of push on your forehead. Any pain or tenderness there?
No.
How about down here?
No.
Okay. All right, I'm going to have you open and close for me. Any pain there? Okay, do it one more time and then clench your cheeks, or your teeth. Okay. All right, I'm going to have you smile for me. And then puff out your cheeks and raise your eyebrows. Okay, that all looks good. Now we're going to do a eye test.
Okay.
Okay. So a couple of things. First thing, I'm just going to have you stare straight at me. I've got my light here. I'm just going to bring it into your eye and then back out. And then do the same. I'm just checking for your pupils, okay?
Okay.
Just checking pupil dilation. Okay, that looks normal. Okay, you'll just stare at this pen for me. Pupils appear to be even. Next thing I'm going to have you do is just stare at my pen,
Okay.
and then I want you to look at the wall behind me and then back at my pen. Okay. Last thing, we're going to just check your field of vision. So I want you to keep your head straight, but just follow my pen with your eyes.
Okay.
Let me know if I'm going too fast. Then I'm going to have you pull down on your eyelids, okay? All right, the sclera is white. Have you had any issues with your eyes recently?
No.
Do you wear glasses or contacts?
I do not.
Okay. Now I'm going to check in your nose real quick.
Okay.
Okay. Okay, that looks good. I'm going to have you close one nostril and breathe in and out. And the other nostril. I'm going to have you close your eyes.
Okay.
Let me know what smell this is, okay, or what you smell.
Lemon.
Lemon, okay. Perfect. I'm going to check in your mouth here. Feel open. Any broken or missing teeth? You don't wear dentures. I'm going to have you stick out your tongue and say, ah. All right, you feel it's been fine. All right, next I'm just gonna kind of feel around here on your neck. Go ahead and swallow for me. I'm gonna listen to your carotid pulses or feel them. And on the other side. Okay, and I'm just gonna take a little listen.
Okay.
Okay. Thank you. Now have you move your head from side to side. No jugular vein distension. Just gonna give you a little pinch here.
Okay.
Just checking to make sure you're hydrated. We call it turgor. That looks good. All right, I'm gonna just kind of feel around here.
Okay.
Any pain or tenderness?
Nope.
Just checking your lymph nodes for any hard lumps or bumps. Your skin looks intact. No bruising. Any pain there? Okay, now I'm gonna check your ears.
Okay.
Okay, I'm gonna just kind of push on any pain or tenderness there.
None.
How about on this side?
Nothing.
Just gonna take a look in here with my light. Alright. A little bit of earwax, but nothing abnormal. All right, next we've got a little hearing test for you to do. All right, so I'm gonna hit this, then I'm gonna put it on top of your head. I just want you to be able to hear/feel that vibration evenly between both ears, okay? Let me know if you don't, okay?
Feel it evenly.
Okay, next one. I'm gonna hit it again. I'm gonna put it back here on this bone.
Okay.
Okay, and then when you can't feel the vibration anymore, let me know and I'm gonna bring it around to the front of your ear. Okay? All right, we're gonna do that on each side.
Okay. Okay. Okay.
And we'll do it on this side.
Okay. Okay.
Okay, it's about 5 seconds behind the ear and about 10 seconds on the front of the ear. All right, next thing I'm gonna do is I'm gonna have you close your eyes for me.
Okay.
I'm just gonna feel it. This is just like the sensitive touch test. So I'll have you close your eyes. Just let me know when you feel this cotton ball on your face and where it's located, okay?
Above my left eye, left forehead, nose, right cheek, chin, behind my left ear.
Okay. This is a sharp and dull test, kind of another sensory test.
Okay.
Okay, this is what the sharp feels like, and then this is the dull. I'm just gonna do it on a couple random spots on your body, so just close your eyes and then just let me know if you feel sharp or dull.
Okay.
Okay.
Dull. Dull. Sharp. Sharp. Dull.
Okay. Perfect. Okay, I'm gonna have you shrug your shoulders. Perfect. Then I'm gonna have you push against my face, push against my hand, and then on this side as well. Okay, that's great. All right, next I'm just gonna feel around on your arms, okay? The skin is intact, no lesions, hair is evenly distributed, temperature is even. I'm gonna listen to, or feel for your pulses here. Radial pulses are even and bilateral. Okay, can you squeeze my hands? Okay, then I want you to push up and flip your hands and push up again. Just see your fingers. Capri fell looks good. All right, next I'm gonna listen to your lungs.
Okay.
Front and back. So, before we get started on that, I just have a few questions to ask you.
Okay.
Do you have a history of any breathing disorders such as COPD, bronchitis, asthma, anything like that?
Nothing.
Have you had any surgeries that would cause any breathing issues?
No.
Okay. Any history of tobacco use?
Nope.
Okay. And do you wear any oxygen at home?
I do not.
Okay. We're gonna I'm gonna listen on the front, and then I'll work my way in the back. Okay.
Okay.
Okay. Every time you feel my stethoscope, just take a nice deep breath. Okay. Okay, I'm just gonna listen up here. Thank you. All right, I'm gonna work my way back here. First thing I'm gonna do, I'm gonna palpate around on your back. Let me know if you feel any pain or tenderness, okay?
Okay.
All right.
That's good. Nothing. All good.
Okay. I'm gonna just check for kidney tenderness here.
Okay.
Okay, let me know if you feel any pain.
Okay. Nothing. Yep.
Okay. I'm gonna have you take a nice deep breath in and out. Okay. Breathing is even. Now I'm gonna take a listen. Once
Okay.
again, every time you feel my stethoscope, just take a nice deep breath. Let me know if I'm going too fast.
Sounds good.
All right, I'm gonna have you put your hands out front, your arms up, kind of like I drew a genie.
Okay.
I'm just gonna listen to the lateral sides of your lungs. Nice deep breath. And one more. All right, your breath sounds are nice and even. Okay, I'll have you go ahead and lay back for me. Are you comfortable there?
About to be. Yeah.
I know, those pillows are the worst. Okay, next I'm just gonna go over your cardiovascular history, so
Okay.
your heart history. Do you have a history of any heart surgeries, heart problems, congestive heart failure, anything like that?
Nothing.
Are you currently on any heart medications?
No.
Okay. So I'm gonna listen to your heart. I have to listen in 5 different spots. That last spot that I hit, I'll have to listen for a full minute.
Okay.
Okay, so it just takes a little bit. Do you have any questions for me?
No questions.
Okay. pulse is 85. I'm just checking your neck again for jugular vein distension. Okay. All right, next we're gonna move down to your stomach.
Okay.
Have you had any abdominal surgeries? Any
No.
recent or past issues with your stomach?
No.
Okay. Any diarrhea, vomiting, anything like that recently? Constipation?
Nothing.
And when was your last bowel movement?
Today?
Okay. Did you take any medications for reflux or anything like that?
No.
Okay. All right, so I'm just gonna listen first. And I'm just listening for some bowel sounds, make sure everything is even. And then I'll kind of feel around on your stomach after that, okay?
Sounds good.
All right, you can just sit back and relax. Five bowel sounds. Five bowel sounds. Five bowel sounds. Five bowel sounds. Skin on your stomach looks even. I don't see any moles, lesions, or anything to be concerned about. Next thing I'm gonna do is kind of just push around on your stomach. Let me know if you feel any pain, okay?
Okay.
Any pain there?
Nothing.
How about there?
No.
There?
Nope.
And there?
Nope.
Okay. Last thing I'm gonna do before we move on is I'm just gonna listen down here, okay?
Okay.
Okay. All right, I'm just gonna apply some hand sanitizer. While I'm doing that, will you go ahead and take your socks off for me?
Yep.
Okay. Ooh. Alright. Have you had any issues with your skin recently? Any dryness? Noticed anything
Nothing.
abnormal? Okay.
Nothing.
I'm just gonna feel around on your legs, kind of like I did with your arms earlier. Just check temperature, and then for any swelling. Have you had any numbness or tingling in your feet?
No.
Okay. All right. Temperature is even. Hair is evenly distributed throughout his legs. I don't feel any presence of edema. Okay, I'm gonna have you put a slight bend in your knee. Can you move your hands for me? I'm just gonna take a look at your stomach while I'm back here. Stomach looks even. Okay, pulses are bilateral and even. Okay. Anterior tibial pulses are bilateral and even. Dorsalis pedis pulses are bilateral and even. You said no pain or tenderness in your feet? Okay, I'm just gonna pinch your toe here. Good calf refill. Can you push up on my hands? Okay, and then I want you to push on them. Okay, while you're in the bed here, we're gonna do some range of motion on your upper extremities as well as your lower extremities, okay?
Okay.
Can you go ahead and lift your arms like this for me? Perfect. And then out to the side. I know that rail's kind of in the way. And then up and down. Any pain when you do that?
No.
Okay. Next, I'm gonna have you lift one leg at a time.
Okay.
Okay. And then one at a time, knees to chest. Okay. And last little range of motion exercise, I'm just gonna have you go in and out. Any pain or tenderness there?
Nope.
Everything's good? You can go ahead and put your socks back on. I'm gonna test your reflexes next. So you can just sit at the edge of the bed. All right. There's 4 different spots.
Okay.
Bicep, tricep, your patellar, and then your Achilles. Okay? So you can just relax, and then I'm just gonna hit here and then just look for a reflex. Okay? It should be involuntary. Okay, and the other side. Here. There we go, maybe. Sorry about that.
Oh,
Okay, I'm gonna have you stand up. If this bed is too tall, let me know. But I'm gonna have you put your leg up like this.
Okay.
And then that's how I'm gonna test your Achilles reflex. It feels funny, I'm sorry. It's like a kind of a funny feeling. You'll feel like a little zing. Okay, and the other side. All right, I'll have you stay standing. I'm gonna have you close your eyes. Okay. I'm just watching to see how your body naturally sways, but I'm seeing if there's any excessive swaying, okay, while you're standing here. You don't sway very much at all. You got good balance. All right, so I'm gonna stand behind you. We're gonna do what's called a whisper test.
Okay.
So I'm gonna check each of your ears. I just need you to repeat the 3 words that you hear back, okay?
Sounds good.
All right. I'm gonna have you plug your, let's see. I'm gonna have you plug your left ear first. Okay.
Basketball, football, baseball.
Okay, and then plug the other ear.
Strawberry, banana, orange.
Okay, I want you to remember strawberry, banana, orange, okay? I'm gonna ask you those again in just a couple minutes, okay?
Okay.
We're almost done here, we're getting close. I'm just gonna check your spine. Spine is midline. Can you bend over for me? Okay, that all looks even. Spine is midline. I have you do some walking for me, okay?
Okay.
Can you just walk to the wall and back? Okay. And then on your tippy toes. And then walk back on your heels. Okay, all right. Do you have any questions for me?
No?
Okay, you can go ahead and put your shoes back on. If you need to make an additional appointment, they can do that for you out front.
Okay.
I'm just gonna document a few things and you can be on your way.
Sounds good.
All right, thank you so much, Andrew. You have a wonderful day.
You too.